Hello, my name is Roberto Acosta, and today we are performing a head to toe examination. This is my volunteer patient, Miss Daniela. So, um, assuming I washed my hands, come into the client's room, and so I'll start out by asking the client her name.
Danielle,
Okay. Date of birth.
9/27/95.
Awesome. And then obviously you consent to perform this head to toe assessment.
Yes.
Okay. So we're going to be going through several systems here. So I'll ask you to sit, lay, stand, but I'll walk you through it, okay? You can tell me the president today.
Biden.
All right, and then the next president for next year.
Donald.
Got it. And then you know what year we're in?
24.
All right, that's good. All right, so that's good enough. All right, next I'm going to perform your vital signs, okay? So, during vital signs, I want to make note of the client's emotional status, tone of voice, affect, mood, psychological state. Is she withdrawn or engaged? Does she look her age? Can she hear me clearly? Can she understand my questions and follow direction? Is her hygiene okay? Posture, demeanor, appearance. I also want to look for any outward abnormalities, such as any amputations, lesions, masses, to include any abnormal smells. Is her skin sweaty or clammy? All of this information will help guide and complete the head to toe assessment and allow me to focus on areas that are specific to the client. So first part of the assessment is we're starting with the head and neck. So I'm going to start with the inspection of the head. Skin color is normal, light and pink. Head size is proportionate to the rest of her body. I don't see any involuntary muscle movements or twitching anywhere in the head. Face is symmetrical with no drooping to either side. Both ears and eyes are the same size as well. And again, both eyes and ears are at the same level also. Now I will test the cranial nerve number 7, which is known as the facial nerve. So I'm going to ask you to do several facial expressions. So can you smile for me, please? Okay, can you frown? Okay, can you puff out your cheeks? Okay. Can you squeeze your eyes closed? Awesome. And then, so you completed that with these, which means cranial nerve is intact. Okay, so for this next part of the assessment, I'm going to put on my gloves. We're going to be inspecting and palpating the head. So, sorry about that funny noise. All right, so you want to palpate the head and look for any masses, any deformities, depressions, or lumps. Your scalp looks clear with no dryness. I don't feel any depressions, masses, lumps. Your hair appears healthy with equal distribution across your entire scalp. Head down, please. Thank you. Hair texture is strong and rigid. So as I move through the client's hair, I want to make sure that there is no type of infestation and also make note for any alopecia, which is any bald spots or baldness. Okay, so looks good. Now, if I were doing this on an immobile client, I would really want to make sure to check the posterior part of the head regularly due to increased breakdown. So all is well there. Now I'm going to palpate your sinuses and put pressure on them. So please tell me if you feel any pain or tenderness at any point. Okay, so here's the maxillary. And this is the frontal. No pain, tenderness, right?
No.
Okay, now I will palpate your cervical lymph nodes. If you can move your hair back for me, please. So thank you. I can feel insides and feel, I'm looking for a kidney size, kidney bean type of size with no mobility, no delimitation, of course, no pain or tenderness. Is that correct? Good. Now I will examine your trachea. I want to make sure that it's midline. Sorry. I want to make sure that it's midline and that I don't see any deviation or masses. I'm going to auscultate your trachea. So if you can just do me a favor and breathe in and out through your mouth, okay?
Through your mouth?
Yeah, with open mouth. Nice. One more time. Good. So Now I'm going to examine your thyroid gland. And so I'm also looking for any masses or lumps, such as a goiter, which you clearly don't. Okay. Now I'm going to move down to the client's eyes and begin by inspecting first. So your eyebrows are full and equally distributed with no scaliness. Your eye position and alignment are symmetrical with no protrusions or deviations noted. I can see that your eyelids close evenly. Thank you. Both sides, your sclera, which is the white part of your eye, is white and shiny. When looking at the iris, the pupil, and your conjunctiva, I shouldn't expect to see any swelling, drainage, or erythema, which is redness, or any jaundice, which is yellowing of the eyes. So, good, healthy eyes. No swelling or drainage from the lacrimal apparatus, which would be the inside area right there. Now I'm going to pull light pressure on your conjunctiva, and gently push down, okay? So, okay. As expected, your conjunctiva is light pink and moist with no abnormalities noted. Your eyes are equal and sit symmetrical in the eye socket. There's no strabismus, which is crossed eyes, noted. So looking at the pupil, I can see that they are equal in size. Go ahead, just look straight at me. Equal in size, measuring approximately 3 to 5 millimeters with no anoscoria, which is when one pupil is larger than the other. Now I'm going to test for cranial nerve number 3, number 4, and number 6. Number 3 is oculomotor, number 4 is trochlear, and number 6 is abducens. So I want to look for any involuntary shaking of the eyes, which is called nystagmus. So I will hold my pen light approximately 12 to 14 inches away from the client's nose, and I'm going to ask the client to please keep your head still while you only use your eyes to follow my pen. Deal? Just your eyes. Here we go. Okay. So that's the 6 cardinal fields of gaze. Again, I'm looking for any nystagmus, which none is noted. Now I'm going to test how your pupils react to light. So I'm going to dim the lights a little bit and then ask you to stare at the wall across, okay? One second. Look straight ahead.
Okay.
And I'm going to be shining this pen light in your eyes. So just keep looking straight, please. Looking for pupillary reaction. Does that hurt your eyes? Okay, all right. So I was able to see both pupils constrict evenly, so that's good. Now I will check for accommodation by placing my pen light roughly about 10 inches away from your nose. And I'm slowly going to bring the pen light towards your nose, okay? So,
And follow it.
yeah, so just look at it right here. Ready? Okay, so that's great. Now I can document that both pupils are equal, round, react to light, and accommodate properly. This is where the acronym PERLA comes from. Okay, so moving on to the next part of the eye assessment, I am going to be using my ophthalmoscope. And I will perform what's called a fundoscopic exam to get a closer look at your optic disc, the cup, retina, and retinal vessels, okay? So if you'll just do me a favor and look straight ahead, please. Let me just fix my... All right, I'm gonna be shining light into your eyes, so bear with me, okay? So I'm gonna put my hand on your shoulder just so I don't make sure I don't run into your face with this. Sorry, so just keep looking straight, please.
It's scaring me.
Open your eye. Okay, good. So I'm looking for any disc bulging, blurred margins, any pallor, or any cup enlargement. I'm gonna do the same thing to your now left eye. So I'm gonna use my left eye, and
Don't run into my eye.
yeah, please stop me if I do. I'm just gonna hold here so I don't. Keep looking straight. Open your eye a little for me. So I'm looking at the retinal vessels. All right, looking good there. Thank you for that. Okay, so now moving on to the next part of the assessment, we are looking at the ears. I'll begin by inspecting the ears, looking for any redness, drainage, masses. I also want to ask the client if she has experienced any pain or tenderness on their ears before I palpate.
No.
Okay. Now I'm going to palpate the ear by gently grabbing it and moving it. Grab the auricle and move it around. Slightly press on the tragus and make sure there is no pain or tenderness. Does that tickle?
Kind of.
All right. Now I want to palpate the mastoid process, which is this big hump right behind the ear. And again, I'm looking for any tenderness, swelling, or abnormalities, which you feel none, right? Okay. Okay, so for this part of the assessments, I'm going to use my otoscope. So if you can just pin your hair there on the side for me. Okay, so I'm going to start by grabbing the auricle and gently pull up and back as I insert the otoscope into the ear canal. And in here, I am looking for cerumen, any drainage, any foreign bodies. Okay. So all is clear, no discharge, swelling or redness. Also, I want to go back and look at your tympanic membrane. So please hold. So pearly gray white, shiny. I could see the light of cone at 5 o'clock. No ruptures or perforations. So that's good. Thank you. Okay, so next I'm going to test cranial nerve number 8, which is called the vestibulocochlear. So I will test this by covering one ear at a time, and I'm going to whisper a word on the opposite ear that's not covered, and then I'm going to ask you to repeat that for me, okay? All right. So look straight, please.
Truck.
Okay, truck, that's it. Okay. All right, so look that way a little bit for me, please, and then
Apple.
great. Okay. Now, lastly, I want to perform what's called the Ryan-Weber test to determine any hearing loss. This is a tuning fork, so there's going to be 2 parts to this test. First one is I'm going to strike it, and I'm going to put this part right on your mastoid process, and I want you to tell me when you know if when you no longer feel the vibration. Okay. Once you tell me that, I'm going to flip this right outside your ear canal, and I want you to tell me when you stop hearing the vibration. Deal? All right. Here we go. This next part, I'm going to strike the tuning fork again, and I'm going to put it right on top of your head, and I want you to tell me if you can hear it on both sides. Okay?
Yeah.
Yeah. Okay. Great. Thank you. Now moving on to the nose, I want to make sure that your nose is midline to your face. I want to look at your septum and make any note of any deviation. Have you been having any issues with your nose, drainage, obstruction, dryness?
Just stuffy.
Okay. Will you do me a favor and cover one nostril and breathe in and out through the other open one? Okay. Do the same thing with the other side. Okay. Thank you. So I'm listening for airflow, for it to be patterned and consistent. Now I'm going to use my pen light and take a look inside of your nose, and I want to look at the quality of your mucosa in here, which is pink and moist. Sorry. Okay. No drainage, no polyps. I can see that everything is intact, and I can see the corresponding meatuses and middle turbinates. Okay. So now I'm going to test cranial nerve number 1, which is olfactory. So if I can have you close your eyes, please. And I'm going to put something right under your nose, and I want you to tell me what you smell, okay? So here we go. What is that?
Alcohol.
Okay, thank you. Moving on. For this next part of the assessment, I'm going to put on some gloves, and we are going to be looking at your mouth. Okay, so first, we want to start off with inspection. I want to look at your lips, making sure that they're nice and pink, that they aren't chapped, cracked, or any sores on them. First, I'll test cranial nerve number 12, which is known as the hypoglossal nerve. And I'm going to ask you to stick out your tongue and move it side to side, please. Okay, great, intact. Now I'll inspect the inside of your mouth by using this tongue depressor here, and press against your tongue, both upper and lower palate. And so if you could come out for me, please. Open your mouth. Okay, lift up, lift the tongue up. Okay, stick out your tongue really quick. Move it to your left. There you go. Okay, open your mouth a little bit more. All right, now you want to see, and lift up your tongue for me.
Wait.
Yeah, so I can look at your soft palate, your hard palate. Open your mouth, like, there you go. Nice. Okay, so I shouldn't be able to see any dry, cracked, or patchy spots. I'm looking for any lesions under the tongue. That's where mouth cancer would primarily be noted. I'm also looking for any cavities, any loose, abnormal position, or broken teeth, which you have all your teeth intact. So the hard palate and soft palate are also intact. And if I can just take a look at, stick your tongue out for me and say, So your uvula is midline. So that's good. Okay, so I'll dispose my gloves and assume that I've done proper hand hygiene. So now we are going to move over to the neural part of the assessment, and I'm going to test cranial nerve number 11, so which is the accessory nerve. Okay, I'm going to ask you to move your head side to side. Okay, up and down. Okay, and then push against my. There you go, and then the other way, down. Okay. I'm going to put my hands on your shoulders, and I'm going to ask you to shrug for me, please, against my resistance, okay? So, go. Okay, great. Now I'm going to assess coordination, and I'm going to ask you to perform some rapid movement. Finger tapping. So if you can, yes, thank you. And then the other side. Okay. Now I'm going to ask you to perform a finger to nose test. So you'll touch my finger. After you touch my finger, you'll touch your nose. Great. Assess your gait. So I'm going to ask you to stand. Okay, so now dispose my gloves and I will perform proper hand hygiene. So now I'm going to find the temporal artery and I will palpate both bilaterally. So yours are right here. They are 2+, which is normal and expected for a healthy person. While I'm in this area, I'm going to test cranial nerve number 5, which is the trigeminal nerve, which helps with mastication. So I will feel for the masseter muscle, which feels like a nice, firm, small ball. Then feel for the temporal muscle. So now I'm going to do another small test to test the same nerve. So I'm going to place 2 fingers under your chin, and I'm going to ask you to open your mouth against the resistance that I am creating. Okay? Go ahead. Okay, good. Now I'm going to feel the temporal mandibular joint, which is known as the TMJ. So if you will please open and close your mouth while I feel for any grating or clicking sensations. Go ahead. Go ahead. All right. Which I don't. Okay. I'm going to ask you just to take steps forward and then backwards. And looking at your gait, making sure you're coordinated. Okay. If you could do me a favor and turn around this way again. Go heel to toe, right in front of the other, all the way to the wall. Great, and then back. Okay. All right. Let's face this way. Last one we're going to perform what's called a Romberg test. So I'm going to ask you to close your eyes and just stand completely still. All right, great. So now I'm going to ask you to please sit back, or lay back down, sit up.
Lay down?
Yeah, just right up against the backrest. So now we're going to do a sensory assessment, and we're going to use this Q-tip. So this is a soft side, this is a sharp side. So if you can put your leg straight for me, what I'm going to do is I'm going to place this in different parts of your upper body and lower body, and I want you to tell me, closing your eyes, I want you to tell me if it's soft or sharp. Ready?
Sharp. Sharp. Soft.
Wow.
Feels soft. Hard.
Sharp?
Yes.
Okay, got it. Okay, great. Now we're gonna use a reflex hammer, which is this right here, okay? And we're going to test the reflexes of the biceps, the triceps, patellar, Achilles, and ankle. So if you'll do me a favor and just let me borrow your, okay, we'll do tricep first. So, all right, it says this one. Okay, let's have this other one. Okay. All right, good. So if you can uncross your legs for me, please. We are going to, actually, if you will sit right on this edge for me. Oh, yeah, that's, there you go. Okay, and now we're doing the Achilles and your ankle. Okay, so moving on. Now we're going to be assessing the upper extremities, beginning by inspecting. So I'm looking for any lesions, redness, swelling. This is a great time to pay close attention to any scars, which can help guide the assessment and provide opportunity to ask any specific questions. For example, I noticed a scar there in your forearm.
Burn.
A burn, okay. So if you can move your hair back for me, starting with the shoulders, I want to inspect for any obvious abnormalities, and of course, I want to ask the client if you've had any issues or problems, pain in any parts of your upper extremities. Okay. Now I want to assess range of motion, doing so by doing flexion and extension. So if you can just push against, okay, pull, awesome. I also want to feel for any crepitus, any grating, as I see. If you can lift up your straight arm and lift up, yeah, and then straight in front of you, down. I feel a little bit of crepitus, interesting, okay. Now the left one, same thing, down, okay. Do in rotation, okay. And then let's go ahead and bend. Got it, okay. Let's go back to this one. Rotation also. Okay, good. So I want to look for any grating and crepitus on the joints. I want to do the same to both sides. So moving to the elbows, inspecting for, again, the contours of bilateral elbows, looking for any nodules, any swelling. I want to assess the range of motion, again, by doing flexion and extension, what we just did. Now I'm going to palpate, starting with your radial artery. So, great, and then I want to do this for both upper extremities. So both, I can feel that they're at 2+, which is an equal, which is normal and expected. So if I can borrow your hands again, I'm going to check your capillary refill. Normally in clients that have nail polish, it's very difficult or almost impossible to see, but assuming that she wasn't wearing nail polish, I'd be able to measure her capillary refill, which we would want to be under 3 seconds for normal. Last thing is testing skin turgor. So small little pinch here. The recoil, if you were dehydrated or any type of skin issues, we'd see some tenting there. Okay. Now I'm going to look at range of motion of bilateral hands. So I want to look closely at the joints, looking for any bone deformities. Usually in clients with rheumatoid arthritis or osteoarthritis, you can see some nodules or swelling of the joints. Of course, make sure to ask the client no pain or issues, correct? Okay. Now I want to check bilateral brachial arteries and which are found here at the bend of the arms, right by the elbow. Actually, relax it for me a little bit. You are. Yeah, over here. So both sides +2. Now, if I had a patient who was on dialysis, I would want to palpate the AV fistula to make sure that there is a throat present. Okay, so now moving on with muscle strength. I'm gonna have you grab both of my fingers and squeeze as tight as you can, as hard as you can. Good. So now I want you to push against my hands, okay? And I want you to pull my hands, okay? So your strength is 5+, which is normal and expected. Okay, so moving on to the next part of the assessment, we're looking at the thorax and lungs. We're gonna start off by inspecting the chest, looking for any abnormalities, any lesions. Also looking at the client's effort of breathing. Is it labored? Are they using any accessory muscles to breathe? In this case, normal breathing. Looking at the anterior and posterior diameter, which I'll do right now when I have you stand up. Right now I'm going to move into the percussion on all aspects of bilateral lobes, lungs, and I'm going to do this on the anterior side, so I expect to hear resonant and tympanic sounds, so just bear with me. I will move to auscultating, beginning at the apex of the lungs, so I will ask the client to breathe in and out with her mouth open to get a good listen of all lung sounds. So starting at the apex, moving to the second intercostal space, listening to the bilateral upper lobes. Now moving to the fourth intercostal space and listening to the right middle lobe and the left upper lobe. Remembering that the right lung has 3 lobes and the left lung has 2 lobes. So now I'll be moving to the sixth intercostal space, which is at the mid-axillary region, and listening to good both the right and left lower lobes. Good, thank you. So now in the posterior aspect of the body, I will do the same process, except keeping in mind that my stethoscope placement will be slightly different because of the scapulas here. So beginning at C7, which is this bony prominence here, moving down to about T3 on each side. Same process, open mouth, in and out, please. This is where I'll find bilateral upper lobes. So now moving in between T3 and T10, I will listen for the lower lobes. Good, thank you. Now moving on to the cardiovascular part of the assessment, I'm going to be palpating the carotid arteries on both sides. Want to keep in mind on these, we want to do one at a time because it does increase the risk of the client fainting. So I'm going to palpate here, which is palpable +2. Other side is also +2. Now I'm going to listen to each carotid using the bell side of my stethoscope, and I'm listening for bruit, which is the swishing sound. So I'm going to ask you to take a breath in and then hold it while I listen. So that way we could avoid air exchange. Okay, so go ahead, take a deep breath, nice and easy, and just hold. Okay, let it out. All right, one more time. Okay, great. So, all good, it's all clear there. Now I will palpate the precordium and look for any heaves, thrills, or palpable heart sounds, and we're doing that by gently placing palm of my hand here in the precordium again. Okay, so none felt. Now I'm going to inspect the interior chest wall, looking for the apical pulse or any precordial movements. Um, Using the acronym of all patients effectively take medicine, I'm going to be listening to the aortic and then pulmonic, and then we're down Erb's point, and then tricuspid, sorry, and then mitral. So, starting with the aortic, which is found at the second intercostal space, which is left of the sternal notch. I'm listening for a luped up, which is the S1 and S2 sounds. Moving over to the pulmonic. So S2 is louder at this location. So now moving down to Erb's point, which is located at the third intercostal space. Now moving down to the fourth intercostal space, where I'll find the tricuspid valve. S1 will be louder at this location. And now moving over to the fifth intercostal space, midclavicular, and listening to the mitral valve. This is a point of maximal impulse where we can establish the apical pulse by listening for 1 whole minute. So for a normal adult, it should be anywhere between 60 and 100 beats per minute. Now I'm listening to the same areas I just covered. However, I will do it with the bell of the stethoscope this time. And I'm listening for any heart murmurs, which will sound like a swooshing or blowing sound. Okay, so now we're moving on to the abdominal part of the assessment. I'm going to keep in mind that the sequence of assessment changes a bit for this part. So it'll start with inspection, auscultation, percussion, and then palpation. So I will ask the client to lay on her back. And of course, I want to start by making sure that I ask the client if you've had any stomach issues or any pain or tenderness in your abdominal area.
No.
Okay. So when was your last bowel movement?
Yesterday.
Okay. Are you having any pain burning with urination?
No.
Any constipation or nausea or vomiting?
No.
Okay. When was your last menstrual period?
A month ago.
Okay. Might want to get that checked out. Okay. So moving on with the inspection, I want to look at the abdominal contour. This client is flat with no protrusions noted. I want to make note of any pulsations in the abdomen. In some clients, you might be able to see the aortic pulsation, which is located right above the umbilicus. I'm looking for any masses, any hernias, looking for any wounds or scars, which would indicate further questions if found. So now I will auscultate using first the bell of the stethoscope, listening for vascular sounds. Listening to the aortic artery for bruits, which would be a blowing or a swishing sound. Now, using the diaphragm of my stethoscope, beginning at the right lower quadrant, I'm going to work my way in a clockwise fashion. So I should expect to hear about 5 to 30 sounds per minute. So beginning at the right lower quadrant. Now, if no sounds are present within that time, I would want to listen for at least 5 minutes straight until I hear some type of bowel sounds. Now I'm going to percuss all 4 quadrants, listening for dullness, tympanic, or hollow sounds, depending on the area that is being percussed. So I'm going to do some light tapping, okay?
Okay.
Now moving on to palpating, starting with some light palpation, going about 2 centimeters feeling for any rigidity, any lumps, masses, or any guarding. Again, always starting at the right lower quadrant and working clockwise. Now we're going to do a deep palpation, which is going about 4 to 5 centimeters this time, looking for the same thing again. Any guarding, rigidity, lumps. Now you can use 2 hands to get a better feel and not make it uncomfortable for the client. Sometimes using 1 hand is not enough. So no signs of peritonitis, which would be evident by guarding or rebound tenderness. Okay. Now we'll measure the size of the liver by using percussion to find the liver edge. So sorry. Okay. Okay, so no enlarged liver seems to be apparent. Now I'm going to percuss for the spleen. So I'm going to ask the client to move into the right lateral debucus position to percuss and look for any spleen enlargement. So on your right.
Sure.
Yeah. Okay. There you go.
Yes?
Yeah. No pain or tenderness here?
No.
Okay, good. Okay, so now moving over to the next part of the assessment, I'm going to be assessing the kidneys and urinary organs. I'm going to perform what's called a coastal vertebral angle to assess for any kidney issues. So I'll be using my fist and the lower aspect of your back. I'm going to give you one gentle thump. Okay, so it's going to be like this basically. So please tell me if you have any pain or tenderness, okay? Here we go. Okay, good. Next, we're moving over to the spine, and I want to inspect the client's posture. If you can just please stand on both. There you go, just straight. So I'm looking at her cervical, thoracic, and lumbar curves. Looking for an upright spinal column. Her shoulders to be aligned. Now, I'm going to assess the range of motion of your spine. So if you could rotate, yeah, both sides, good. Can you bend a little, or just, yeah, go backwards a little bit? Okay, good. Can you do side to side? Just bend to one side and then to the other. Okay, thank you. While I have you in this position, actually, I want to do check the anterior posterior diameter, which we didn't when you were laying down. So here I'm basically just looking at the anterior posterior chest. Ideally, in patients with COPD, we would expect to see what's called barrel chest. In this case, you're healthy, so none of that. So moving forward, now we're going to be assessing the lower extremities. So I'm going to ask the client to lay in the bed so that I can assess the hips, knees, and bilateral feet. We'll start with inspection. If you can put your leg straight, please. Looking for any abnormalities such as atrophy, bruising, or any length symmetry, which we don't have here. So now moving to assess the range of motion, So now moving forward, we're going to assess range of motion, starting with the hips. So if you can lift up the one knee at a time, there we go, like that. And then the other one, okay. And then do it against resistance, okay. The other one, okay, great. Now I'm gonna ask you to bend your knees. And then out, okay. I'll bend them all the way out, okay. I'm gonna ask you to do internal rotation and external rotation. There you go, with both, okay. So abduction and adduction, I'm going to ask you to just slightly, one leg at a time, There you go. Now the other one. Okay, great. So put your feet up straight. I'm gonna ask you to press against my hand. Good. The other one. Good. So now both of them. Okay. And lastly, we are going to we're going to elicit stimulation of the plantar reflex, which is also known as Babinski's reflex. So using our, our reflex hammer here, we're going to gently, just put your feet out, please. I'm sorry, it's part of the assessment here. Okay, so relax. Because a normal reaction should be that the toes curl. So, are you ready? Okay, so
I'm not normal.
that completes the head to toe assessment. I want to thank you for helping me out this semester, and thank you.